Hi everyone, I'm Saja, a medical student, and today we're going to talk about the hypertension or the high blood pressure, which is one of the most common diseases around the world, and that over than 1 billion people around the world have the hypertension or the high blood pressure. The blood pressure usually defined or represented by two numbers. The top one, or the first one, refers to the systolic pressure, which usually happens when the left ventricle exerts, or we can say when the heart is contracting. The lower number refers to the diastolic pressure, which happens when the heart is relaxing or refilling, and we can say that diastolic pressure is the aura pressure at rest period. According to the American Heart Association, they say that the blood pressure considered to be normal when the diastolic pressure is lower than 120 mm of mercury, while the diastolic pressure is considered to be normal when it's less than 80 mm of mercury. And when those numbers are higher than the expected normal range, we can say that the patient has hypertension or high blood pressure. The hypertension actually can be either isolated systolic or diastolic pressure, or both of them will be high, and by the way, this is the most common case in most patients. Actually, the American classification for the blood or for the high blood pressure can divide the hypertension into two stages or two grades. The first one is when the systolic blood pressure is between 130 and 139 mm of mercury, while the diastolic blood pressure is between 80 and 89 mm of mercury. The grade 2 is when the systolic blood pressure is higher or equal to 130 mm of mercury, while the diastolic pressure or diastolic blood pressure is higher or equal to the 90 mm of mercury. And there is an idiom, which is the pre-hypertension, when the systolic blood pressure is between 120 and 130 mm of mercury, while the diastolic blood pressure be at that time lower than 80 mm of mercury. You really have to know that more than 1 billion people around the world have hypertension. 90% of them don't have or refuse taking their antihypertension, and 9% of the patients, their hypertension or their HTN has no symptoms. Alright, if your blood pressure gets really high really fast, so in that time we will have the hypertensive crisis, which is really dangerous and can lead to a stroke, and is divided actually into two categories or two parts. The first one is the urgency hypertensive, and the second one is the emergency hypertensive. The urgency hypertensive actually don't have a damage to the end organs like the brain or heart or the liver, while the emergency one has a damage to these organs, and this type can be associated, let me call them, with life-threatening complications. Actually, there are two types of the hypertension. The first one is the primary one, or we can call it the essential one, which happens in about 95% of the patients, having no specific clear reason. But some studies have shown that there are some potential dysfunctions that may be responsible for the primary hypertension, like the hyperactivity of the sympathetic system, which can affect on the ventricles, causing vasocontraction and then increasing the total peripheral resistance and then increasing your blood pressure. The hyperactivity of the sympathetic system at the same time can affect on the ventricle myocardium, increasing the contracting force and then increasing the stroke volume, increasing the cardiac output and then increasing the blood pressure. The hyperactivity at the same time can affect on the AS node in the heart, increasing the heart rate, and as you know that will increase your cardiac output and then increasing the blood pressure. Also the kidney, and specifically the juxtaglomerular apparatus, when it secretes the renin, that will increase the production of the angiotensin type 2 and then increasing the blood pressure. Also, the kidney, because of the weird reason, can increase the secreting of the renin and then angiotensin type 2 and then increasing the blood pressure. The American studies have shown that there are some risk factors that can lead to the hypertension, like the obesity, vitamin D efficiency, and if you are diabetic or you are having the insulinemia or hyperinsulinemia, that can lead in a way to elevate your blood pressure. Going to the secondary hypertension, which happens in just 5% of the patients who are most of the time young. The reasons will be the kidney diseases. So if the kidney is damaged, that will play a big role causing the hypertension type 2. And the kidney diseases can be divided either renal, parenchymal, and actual renal tissue diseases or a damaged vessels. Diseases like the glomerulonephritis, diabetic nephropathy, and many more can affect all the collecting ducts, the proximal tubules, the loop of Henle, and even the glomeruli. While the vessels damaged like the renal artery stenosis can lead to increased blood flow to the kidney and then increased urinary excretion, and that will lead in the way to increased blood volume and then increased blood pressure, as you know. So going to the endocrine causes, we can say that the adrenal gland, when it oversecretes the aldosterone, especially in Cushing syndrome, that will lead to increased sodium and water reabsorption, increased blood volume, and then increased blood pressure. While in Cushing syndrome, we can say that the cortisol now is secreted in higher amounts, and then the norepinephrine and the epinephrine receptor sensitivity will increase. That will lead to vasocontraction and then increasing the blood pressure. In another way, the hyperthyroidism will include elevated T3 and T4 hormone. That will increase the heart rate and then leading to hypertension. While in an unexpected way, the hypothyroidism, which includes a lower T3 and T4 hormones in the blood, will increase the systolic blood pressure. And finally, the hyperparathyroidism will increase the PTH in the blood and then increasing the calcium and then causing the vasocontraction and increasing the peripheral resistance and then increasing the blood pressure as you expect. And for the symptoms, actually the primary hypertension has none. That's why we can call it the silent killer. For the secondary hypertension, it has symptoms, but they are associated to the real cause that led to the hypertension. For the hypertensive crisis, especially the emergency one, it can lead to the breathlessness. For the treatment, finally, there is no specific promising treatment, and most of them are based on the lifestyle changes like doing exercise, stress reduction techniques, eating diet, in addition to the anti-hypertension medications that play a role in many techniques in many ways to reduce your blood pressure. That was all for today. Goodbye.